Thank you so much, Alex. They were beautiful words. We really value and appreciate your voice, and to all those with lived and living experience. Thank you so much, Kelly, for your story this morning. It's great to start and finish with the voice of living and lived experience. And we do know that a large part of our workforce also does have living and lived experience. You both mentioned language in your presentations as well, and I think that we've gotten a lot better, and NADA and MHCC with our drug user organisation as well have developed resources around language, and I think Alex just talked about some of those differences in languages that we have between the mental health and drug and alcohol sector, and I remember discussions with the former CEO of NADA and the MHCC in my early years having very similar discussions, but I think there is a real opportunity for us to come together and have a shared, I think, we have a shared vision, but having that shared language as well that is inclusive. And yes, I think the people we support, the frontline and our sector, do need to thrive and not just survive. So I think today we heard a lot of challenges, but we also heard a lot of opportunities. There's a hell of a lot of experience in this room, and I discussed with some of the seniors in the room that we also have a lot of younger people here, and I think that diversity in our workforce is really important to sustain us and to have different ideas. Not that us that have been around for a while don't have good ideas still. We've got a lot of damn good ideas. But I was just reflecting before as well and thinking about, we may have tried something 10 years ago and maybe the system wasn't ready for that idea at the time. So it may be that we don't always need new ideas as well, but maybe we need to seize opportunities when they arise. Minister Jackson talked about the drug summit as being one of those opportunities. And what did she say? Her words were, "It will be good." But importantly, that it's not just about alcohol and other drugs. We talked before, this is a whole of government strategy that is inclusive, that brings together mental health. And actually, I think that's another reflection that I have on today is it's not just about mental health and AOD. We're talking about holistic care. The Minister talked about housing, and I think we've heard it in all of our presentations. This isn't just about coexisting mental health and alcohol and other drug issues. It's about responding to the person and their needs across many domains of life. So the Minister also talked about building up of progress, and I think she was trying to allude that, we actually have made progress, and I was also reflecting on that about, when we had the conference 15 years ago, we did make progress, and I think we have come forward in some ways, but I think we've also come back in some ways as well. There was some investment. Government's good at investing. There's an issue, let's throw some money at it. 4 years, the money finishes. I think about things like the Improved Services Initiative that gave NGOs money to build capacity. We were talking at lunch with someone about there were positions that were there to facilitate partnerships. It takes a lot of work to facilitate those partnerships. I think Carmel talked about that in her presentation as well. So I think for what we take away to today in terms of NADA and MHCC, it's not a talk fest. We do want there to be action as a result of this. And I kind of framed my reflections in terms of policy and advocacy, sector development, workforce and research. And I know, I think my comment from earlier still stands around research, is that we need to be driving that research agenda, and research needs to be embedded and driven by practice. Yes, there's an opportunity for academia and other to have their own priorities, but we collectively need to work together and making sure that the voices of lived experience is part of setting that research agenda as well. Funding, always. It is important. We joke about it, and sometimes we go to consults and we say we're not going to talk about funding today, but actually it's hard not to talk about the resources that we need to actually deliver the outcomes that we want to achieve for people. So it's very unsurprising that we talked about that. I kind of reflected on sometimes the NGO sector needs to compete with our public sector counterparts, and I don't think any of us would disagree that the public sector needs to be well resourced as well. But there's a bit of a what about me type of effect. And yes, we have different ways of tendering in terms of competitive tendering, but there needs to be better ways to look at how we appropriately fund the community sector. I thought there was an interesting discussion about integrated care and integrated policy, and I reflected we've got a director from the Centre for Alcohol and Other Drugs sitting here. We've got a director from the Mental Health Policy Unit, And sometimes I get concerned when we have these things about this idea of integrated policy. And for me, I still have anxiety from when it was the Mental Health and Drug and Alcohol Office, because alcohol and other drugs is such a small component, and alcohol and other drugs has never had such a focus in the policy space as it has right now. And for me, that's really important. It doesn't mean that we can't connect. It doesn't mean that we shouldn't have integrated services and that our policy people should be connected and talking to each other. It's just something that I reflected on there. And so I'll wrap up. Our sectors are united to deliver person-centred, trauma-informed, culturally responsive care that support the person holistically. It's not just about mental health and AOD. We've got a passionate and extremely dedicated workforce, but we do hear your frustrations. And our frontline workers and those accessing services are the ones that feel that frustration the most. But we see today as an opportunity to turn around these discussions into actions. We're going to be writing up a report. There's opportunities for collaboration across all those 4 areas, and I think NADA and MHCC haven't had an event together for a while, and I think it's probably been too far in between rodeos, as I said this morning. So we do have some joint training that I mentioned, focus on the front line, that will be coming up in the next month or so. It's really great to have director level people here from the ministry, and we will continue to engage with them. We had the Minister for Mental Health, we had the Acting Commissioner, the Mental Health Commissioners here as well, and we'll make sure that they understand the key points of today. But we really appreciate your contribution, and we definitely need to maintain the momentum that's being built. So I'll now hand over to Evelyne, but just a final thank you to our members that are here today and to the team from NADA and MHCC, and I'm sure Evelyne will also be thanking them, but they really are the ones that make this possible. Evelyne and I have the luxury of coming up and welcoming you and then having our reflections at the end of the day. The work happens by these other people in the room, so thank you so much to the team for their work.
Thanks so much, Rob. Gosh, we've delved into a lot for only a couple of hours together. We've explored critical issues, some solutions, and shared best practice. Some of the key takeaways for me, honestly, I just did a LinkedIn post because I have to try and capture, and I feel like I've started a mini thesis, not another one, but my paperwork's all over the place, my notes are all over the place, and Rob is sitting there typing so eloquently. And I have to say, Ben, you are incredible. I don't know how you synthesize. Well done. Just incredible. So I can't synthesize the way that Ben, maybe I should have had Ben on my side when I was doing my thesis. Anyway, artist in resident for the day has been phenomenal. I'll just start at the beginning with Uncle Michael, and I promise I won't take up too much of your time, but the Welcome to Country for me, I did speak about it when he finished it, and that was about the values that underpin our work, and I think it was really important. I think it's also, Uncle Michael taught us about learning the culture of Aboriginal and Torres Strait Islander communities and learning from their culture and embedding it in our daily lives, in our work. Minister Jackson spoke about co-location. I think later Dr. Lisa spoke about integration. So how do we co-locate and integrate? Maybe not departments, but certainly in service delivery. Bilat agreements, it wasn't used as such in that language, but how do the Commonwealth and state governments work closely together? We know in the PHNs they're doing that, but how can state and Commonwealth departmentally work together? Whole of government approach, it is a conversation that's been had at the moment. I think it's started a little bit with having the Minister for Homelessness and Mental Health, but that integration is yet to come. And how do we work with other social determinants in that whole of government approach? Kelly was wonderful. Thank you so much, Kelly, for what you've shared with us around, I think, emphasising trauma-informed and a recovery-oriented journey practice. But for me, it's also about person-led rather than person-centred. So that was something that rang through for me, and the fragility of sanity, that's stuck with me. And also conformity and treatment resistant versus learning to embrace voices and meaning making. So thank you for that. Overall, a couple of, my notes are starting to go everywhere, and I can tell my team are going to kind of go, she's not following anything. So funding, I'll emphasise, and I'm such a wog, my hands go everywhere. Funding and more resources. What can we do with all that? Workforce. We last week launched our workforce solutions paper. We had done a profile report in November, which was looking at the CMO sector for mental health, and last week we launched a solution solution paper with 15 very clear solutions that we identify, and we're looking for a commitment from government to fund a 10-year strategy. Lived experience, not just leaving it as a side note, but keeping it front and centre and making sure it's not just a value add, but it's front and centre in everything we do. We've spoken a fair bit about language and stigma and how that can reduce stigma and discrimination. There was some really good commentary about data that didn't get so much attention, but it was still mentioned about how do we consolidate and systemically and consistently create centralised data so that we can actually potentially identify the needs and the gaps from that and then build on that. Access and equity, and particularly I got the sense from rural and regional communities and increasing step down programs. Couple of other things. I think for those of you who know me well, I'm always quoting Maya Angelou, who is a great activist and a superwoman, and I'm going to combine two of her quotes, so bear with me. We've made a lot of progress and it's going to keep getting better according to how we put our courage forward and thrust our hearts. Do the best you can until you know better, then when you know better, do better. We may encounter many defeats, but we must not be defeated. And I hope that that leaves a message for you, because I think we started the morning pretty somber going, 15 years later, we haven't really done much. But we actually have made a lot of progress, and we just need to keep persevering and know that every difference we make in an individual's life is actually a change we're making for an entire community. So a couple of administrative things. I believe that a mailing list is going to be sent out with all the attendees from today. So if you don't want to be on that list and you want your information kept private, please just speak to someone at the front desk as you're leaving. And as Rob indicated, we're going to compile a report and also submit that to the Ministry of Health and also to the Commissioner who is here today, who funds COMDA, the Community Mental Health Drug and Alcohol Research Network, of which this forum is a part of. So I want to thank each and every one of you for your contributions today, for taking a day out, mostly out of operations, and to join us for today's symposium. Your thoughts are appreciated, your participation in today's activities, but also in your day-to-day work. I'd like to thank the team at MHCC and NADA for the hard work they went into the development behind the scenes. Thank you again to all our speakers. It's been an honour to have you as part of today's conversation with you all, and I look forward to continuing the collaboration moving forward. Now, I'm just going to do a quick shout out. Kate and Katie, is there anything I've missed? Great, I've read all my text messages. Thanks everyone, have a lovely afternoon and drive safely. Take care.